this is not the last major outbreak we're ever going to see.
Will people listen to scientists?
Elsewhere, the impact of COVID-19 is just beginning.
The difficulty is that if you do not try and suppress this virus, it can overwhelm your health system.
According to the World Health Organization, COVID-19 is a disease caused by a new strain of coronavirus. It is a new virus linked to the same family of viruses as severe acute respiratory syndrome or SARS and some types of common cold. COVID-19 has affected how we live our lives today, from how we go to the mall to how we educate ourselves. In an effort to promote social distancing, schools have been holding online classes instead of the traditional face-to-face setup.
Now that we mention it, what is social distancing? Social distancing is one COVID-19 prevention method, which means keeping a safe distance of at least 6 feet between yourself and other people who are not from your household. Besides that, the CDC also defines it as remaining out of congregate settings as much as possible and avoiding mass gatherings. Social distancing aims to slow down the spread of disease by stopping chains of transmission of COVID-19 and preventing new ones from appearing. It reduces contact with contaminated surfaces while encouraging and sustaining virtual social connections within families and communities. It is often practiced in combination with other COVID-19 prevention methods such as wearing masks and face shields.
Why practice social distancing? First, people in close contact for a long period of time often spread the virus amongst themselves. When the infected coughs, sneezes, or talks, droplets are at risk of landing in the mouths or noses of people nearby. According to recent studies, asymptomatic infected people play a role in spreading the virus, so it's important to stay 6 feet away from everyone as much as possible, even if you or they don't have any symptoms. Social distancing is especially important for people who are at higher risk for severe illness from COVID-19. These include older people and people with chronic medical conditions.
Second, social distancing helps limit opportunities to come in contact with contaminated surfaces and infected people outside the home. Other than landing on the mouths and noses of people, droplets of infected people also land on surfaces, leaving those who touch these at risk of contracting the coronavirus. COVID-19 can live for hours or days on a surface, depending on factors such as sunlight, humidity, and the type of surface. On metal, like on doorknobs, jewelry, and silverware, the virus can live up to 5 days, while on wood, like furniture, it can live up to 4 days.
According to Robert Steiner, a reduction in social contact can reduce the spread of the coronavirus. With normal behavior, one person can infect 406 people in 30 days. Meanwhile, with 75% less contact, one person can infect only 2.5 people. Through social distancing, we reduce the risk of catching the virus and reduce the risk of spreading it to our loved ones and within our community. Therefore, we have to practice it to keep everyone safe and healthy. Like Coca-Cola says, staying apart is the best way to stay united. And thank you for watching.